Tobacco contains the addictive drug nicotine. Nicotine is absorbed into the bloodstream when tobacco is chewed or smoked. Dr. Dan Blocker, the Director of Behavioral Health at Pomona Valley Hospital Medical Center, reveals how you can know you are addicted to tobacco.
The way that you know that you're addicted to something is when there's an increased need, an increased dependency, and it's impacting your life or the lives of others. For things like tobacco, there is an increased dependency. There is an increased need for it, a compulsive desire to do it, and a diminished ability to stop. It impacts people's lives in a lot of ways. The biggest factor with tobacco is going to be the health component.
Ask yourself these questions if you think you're addicted.
Can you go days without smoking? Can you make it a week without smoking, without having side effects, without having withdrawals? If you have withdrawals, then you are addicted to the substance.
Why is it so hard to quit smoking tobacco?
Tobacco is a tough beast. It's tough for a couple of reasons. First, it's something that many people have done for most of their lives when I work with them. The other piece is it has become a reliable stress management tool. So for people who have depression, people who have anxiety, tobacco can be a big part of it, and it can be very hard. It's associated with feeling better. So you need the proper management of those mental health concerns in order to increase the likelihood that you're able to stop smoking.
Therapy helps patients make healthier choices.
The most important thing that we do is partner with patients, connecting them to their values. And different addictions get in the way of that. For example, with dads or moms who love their kids and yet smoke all the time. It impacts their ability to connect with their kids. It impacts the health of their children. And so it takes a lot of skill to not shame the parent for that behavior, but instead to partner with them and say, what matters to you? And oftentimes they'll say their kids, and you'll say, wow, your kids matter to you. How is smoking helping your kids, and how is smoking hurting your kids? People will start to realize that there's a disconnect between who they are, what they're doing, and what they value.
Nicotine replacements can help with tobacco addiction.
The replacement, the nicotine replacement, things like the patch, things like the gum, not only can you get those a lot of times free now through different agencies, but they can help reduce the need to smoke. If you are an older person who is trying to quit smoking using vaping, it's actually helpful. If you are a young person starting smoking using vaping, you're more likely to use tobacco later on. So keeping that in mind. Smoking is not something that you just fell into. You did this for years, and it can take time to overcome it. But the reality is that most people are able to overcome this and stop smoking completely. When people come to me and they've been smoke-free for a week, for 2 weeks, for 3 weeks, they start noticing the differences. They're able to move without feeling exhausted. They feel brighter, they feel happier, they feel free. And that is a pretty exciting thing to see.